Hi, everyone. We're just going to let people log in here for a couple minutes before we get started for our virtual event. And stay tuned. We'll get started here shortly.
Wow, Stacy, Lauren, Dr. Robbins, we've got a lot of people here interested in being educated on hair. This is fantastic.
Yes, it is.
There we go. Yeah. Because we're giving away something.
Yes. Yes, Doc, we hear that. But it's a good reason to attend, right?
That's exactly right.
Yes. Excited to share more about this too. It's just such a good program and option for people. And even if they're not necessarily like experiencing hair loss at the moment, it's just a good to know what to look for and what you can do about it.
Oh, Lauren, I couldn't agree more. And of course, I think we all have people in our lives, even if we're not suffering from hair loss ourselves. I bet we could all count that of people that, friends, family, brothers, sisters, mothers that are suffering from hair loss right now.
Yes. All right, we're going to get more people added here. Get started, and we'll just continue to let people in as they log on. So hi everyone, my name is Lauren Caleb. I'm a team member here at Des Moines Plastic Surgery and Coach Light, and helping to lead this conversation about our non-surgical hair loss solutions at Des Moines Plastic Surgery, and most specifically the GetHairMD program that we exclusively offer and have seen a lot of success since we launched it earlier this year. So glad you're all on the call today. A couple of items, housekeeping items before we get started regarding our event-only offers as well as the treatment giveaway. You do need to stay till the end of the event to participate or be eligible for that, and we will share more information about that at the end of the call. And trying to be mindful of people's time, we'll try and get this webinar completed in approximately 30 minutes. If you know Dr. Robbins, he gets quite chatty, so we'll have to give him a little buzzer or something if it goes too long. But excited to get started. So without further ado, we wanted to introduce our two special hosts for today, which is Dr. Robbins, the board certified plastic surgeon at Des Moines Plastic Surgery. If you're not familiar with them, we're over 20 years practicing exclusively in cosmetic surgery, and we have had hair loss solutions at the practice for over a decade, really actually 15 years, and has his own personal testimonials and experience with hair loss and solutions that have worked for him. And then also alongside Dr. Robbins is a team member physician associate Stacy, over a decade of experience in her practice, and she helps lead with the GetHairMD program that we offer, knowledgeable very much about all the treatment options that we have, and has personal experience herself using the GetHairMD program. We also have a third guest speaker on our call too to help with this, support this virtual event today, which is Trace Hirschman. He is the co-founder and president of GetHairMD and has helped build this exclusive network to over 70 physicians and partners. And what's great about this program is that it's it has over a 90% success rate. And we're excited to have Dr. Robbins lead the conversation here to educate you more about hair loss and the treatments that you can utilize with our practice to help regrow and regain. Is that a good elevator pitch, Dr. Robbins, or what do you think?
That's good.
Yeah.
Okay.
Thanks, Lauren, for the introduction, and welcome everyone. Appreciate you joining us. We have a lot of slides to go through, so I'm going to just kind of keep moving along. And Trace and Stacy are going to kind of chime in on different things. But just briefly, before we get started, I've been doing, as Lauren commented, I've been doing NeoGraft, which is the surgical option. This is this discussion on the non-surgical options, which is GetHairMD. But I was doing hair transplant for years, and that's surgical replacement of hair that's fallen out. We didn't really have a good program, though, to maintain or to kind of decrease ongoing loss. And so you were just kind of putting a Band-Aid on it. These people would come back and they say, hey, I need more grafts. And so we really didn't have a all-inclusive modality like GetHairMD until we met Trace, and he told us about it. We learned about it. And there's just multiple different things that are targeting the multiple things that are causing hair loss in both men and women. So it was a perfect item for us. Plus, a lot of women don't get hair transplants because we have to shave the back of their head, and we didn't have many options for them. And so this works. We see lots and lots of women that are having thinning hair, and they're seeing some great results with this GetHairMD. So we've had it for about a year. We'll go ahead and get started. Women, actually, you think about guys balding, but women, 40% of them have hair loss. We're seeing a whole lot more of it with these weight loss drugs, the GLP medications. So we're seeing more of that in the woman population. It's a little different pattern of loss as you see in men, but it's much more, not that it's not devastating for a man to be bald, but it's a little bit more socially acceptable. And with women, it can be very, very devastating to have thinning hair, where it's, especially when it gets pretty pronounced and noticeable. So again, next slide. So like I said, about 50% or maybe even more suffer from with hair loss or thinning. Go ahead. Female characteristics of hair balding or thinning is very different than men. It tends not to be that pattern that you see in a man where it's the frontal area and then the crown. It tends to have generalized diffuse loss. Usually starts in the part line area, and then it just starts, the mechanism's a little different in female as well. Next slide. The typical for the males kind of starts out as a receding hairline or an area, in the crown that gets thin. And if that progresses, you can just get that horseshoe pattern where there's complete loss on the top of the head. Next slide. And it comes in different characteristics. You could have diffuse shedding, so noticing a lot of hair in the shower after you're washing your hair. Sometimes it has no pattern. Oftentimes in women, it has no real pattern. You got rapid shedding of your hairs, or the hairs just you brush your hair and it's comes out easily. So next slide. So there's some different causes of hair loss. 95% is from the what we call androgenic alopecia. That's male pattern or female pattern hair loss, and that's the most common. Next. So the options, what are your options if you have problems with hair thinning or baldness? So I touched on the NeoGraft hair transplant. That's what we do here, and we've been doing it for about 15 years. It works very good. Other options, non-surgical, are PRP or platelet-rich plasma. It's a growth factor from your own body that we inject or use topically. We've been using that for a while. We see some good results with that. However, as you get older, your PRP gets less effective. It has fewer growth cells and proteins. And so you kind of age out of the effects of that. It's better when you're, in the 30s or 40s. And then the GetHairMD system, which I said we've had just over a year, and we'll get into that. That's what we'll discuss mainly today. There's in-office and there's out-of-office treatments. We're going to start with the in-office portion of the pie there. So next slide. So one of the coolest things and the most beneficial for educational purposes is the diagnostic imaging that we have, the AI imaging system that you see here. It's a really cool device where we can actually, it's simple to do, and it actually can show on a magnified view on the screen there. You can see that's a magnified scalp of somebody. You can actually see down to the root of the hair of each individual hair follicle, and it can give you the idea, give you a sense of how many of your hairs are in a healthy growing state or those that are in a sort of a dormant, destined to fall out state, and it gives you a little percentage. And so that's a good starting point just to show people. And we like to do that at the front end, and then after about what Stacey, about
6 months or so after treatment.
Yeah, and that's when you can see the difference on this. It gives you a percentage. So next slide. So one of the things that Trace may comment on as well, they've really come up with this all-inclusive suite of options, the in-office things, the at-home care, and the pharmaceuticals that we're all get into here shortly. But the best thing from my standpoint, from a sort of a doctor, medical person standpoint, is there's so many different causes and ways to address hair loss. And that is the key difference between this and a lot of things that you can buy off the internet, or you just buy one product and that's affecting one aspect of your hair loss or your thinning. We can target multiple with multiple modalities. We can target multiple causes of your hair loss. And that's really the key thing. Trace, did you want to comment on that at all?
No, I think that you hit the nail on the head there. Hair loss there's never just one reason that people are losing their hair. It's always a multitude of reasons. And that's how we address this in a non-invasive, non-surgical way, is by addressing all of those variables and all of those different reasons that people are, that men and women are losing their hair. If we address all of those up front and at once, then it allows us to get the fastest and most consistent results, while, as you see here, at the same time, giving people the resources and the tools to be able to not only treat themselves at home, but also be able to have maintenance for years and years to come. And for our pharmaceutical support I know that we'll get into a little bit more detail here in just a moment, that is a customized to each person prescription that we're very, very proud of and have a lot of success.
Okay, thanks. Next slide. So here's some of the items that we'll get into more specifically. We have the clinical hair growth laser, which is right behind me. Stacey's going to demonstrate putting that on. That's here in the office. It's an in-office option. And then there's the dual wave energy cap that's used at home, the genomic testing that we'll talk about, and then the specialized prescription topicals, the Neo system that we'll talk about as well. Next slide. So this is the clinical hair growth laser. It's FDA cleared. There are a lot of lights out there or devices like this, and they're nothing more than red lights. This is FDA cleared, and in order to get FDA clearance, you obviously have to show that it's safe, but it also that it has efficacy and that it works. So this is a real Class 2 medical device, and it has been shown in clinical trials to promote hair growth and treat androgenic alopecia, which is the most common reason people lose their hair. Next slide. So how does it work? A lot of you guys have heard of DHT, or dihydroxytestosterone. That's the main culprit in hair loss in both men and women. When that level in your body gets raised or higher, it chokes off the hair follicle until it no longer grows thick, long, full-sized hair that we want. So what this laser has been proven to do is the clinical laser that we have is applied to the scalp, and the energy is absorbed by the hair follicles, with the result of, over the course of several months, the follicles begin to heal, and then they start to grow normal, thick, long, full-size hair. So it's stimulating dormant hair follicles that are destined to fall out. It gets them growing again. Any comments on that?
It's 30 minutes under the light per session. It doesn't produce any tingling or heat. It's just, most people bring their phone or something to watch or earbuds to listen to during the procedure.
Next slide. This is just somebody under the laser there. So as she said, it's about 20 to 30 minutes. No side effects. Just come in, have it done, and then you're out of here. So next slide.
Yes, and actually, I'm going to pause here for a minute. We'd love to have Stacy do the live
Absolutely.
demo of putting the clinical growth laser on Dr. Robbins. And while she's doing that, guys, if you have questions that you want to ask Dr. Robbins and Stacy and Trace, you're welcome to submit those in the chat option of this Zoom call, and we'll try and get to as many as we can live, as well as potentially just answer them back after the Zoom call via messaging it. So if you have more questions, use the chat feature and we'll answer those later on in the segment. And I'd say timing wise, Dr. Robbins, you're doing great.
Okay. All
You're looking good.
Yeah, looking good. Next slide.
Yes. Oh, Stacy's in the back there applying it now.
Oh, I just did. Yeah.
Oh, okay, great.
So that's one of the in-office modalities that we have. So it's been shown that the 3 stages of results with this the in-office laser and the red light wavelength therapy is prevents further loss, improves hair quality, and actually regrowths hair. Now, if you put it on somebody's bald head and they don't have any hair on the top of their head, there's nothing there to stimulate, so it's not going to work. You got to get on top of this when you're starting to notice thinning and that the hair follicles are not actively growing. So as I mentioned, it actually increases the health of your scalp and stimulates those hair. It's almost like fertilizer. I tell people they can kind of understand it from that standpoint. So next slide. So the pharmaceutical support part, specialized prescription topicals. Next slide. I use these products, and I don't know who told me, but I was using minoxidil. You've heard of that. A lot of people use that. You can buy it online, buy it at Walmart. Works well. Been around forever. It's got great research behind it. But I don't know where I found out about it. And maybe Trace told me, but a certain percentage, what percentage of people don't even respond to it?
Anywhere between 38 and 40% of the population.
Yeah, and I'd been using it for years. And I mean, my hair wasn't falling out, but it wasn't getting any worse. It wasn't really getting any better. So I thought maybe I've just been doing this for nothing. And so that's kind of a segue into this, the genomic testing. We will take a swab of the inside of your cheek, send it to a lab, and they will tell you, based on that, the testing they do, what medications work best for you specifically. And I, thankfully, when I got it done, I respond to minoxidil. So there are a lot of things out there that don't work at all, or they aren't effective in all people. So this really makes it very specific to each individual. So the topical, they'll send you a topical prescription, and I've been using that for years. It's got 3 products in it, and I respond to all of them. So it's pretty cool concept. Anybody else have any comments?
Yeah, it's cool to get the It's cool to get the report back and see like what each patient responds to specifically. So this is custom tailored to each patient, and you know you're going to respond to the medication, and it's prescription strength. You can't get this over the counter.
Next slide.
I want to chime in real quick, just as like a consumer too. I think that that's very interesting that like the minoxidil scenario, it's like a 40% almost fail rate, and you don't even know unless you get this like genomic testing option to see if you would even respond to it. So I think that's like a unique thing that we offer. If you're wanting a prescription level application, you're getting one that you know that you would respond to as well.
Right.
Right.
And then the at-home care portion here. So next slide. So this is similar, a little different, slightly different technology as the in-office light therapy. This is a dual wave energy cap. You wear it at home. Next slide. It's FDA cleared as well.
And it's unique to Dr. Robbins with like the red and orange light
Oh,
therapy.
right. Yeah, I forgot that. Yeah, so the red light, it's got to be the right wavelength, which it is in this. That's where I was commenting that, a lot of caps have just red light bulbs in there, or that it's nothing at all that works at all. The orange wavelength is something that's pretty unique about this, and that actually inhibits DHT production. But in a nutshell, it's been shown clinically and FDA cleared to increase local blood flow. So stimulating oxygen and blood flow and healthy things to those hair follicles, reduces inflammation, which is a key factor in hair loss, and then inhibits the DHT production, which is the main cause of hair loss.
And we've got a few questions here, if you don't mind me answering here. First question is, are there other options to do red light therapy other than coming to your office? As you can see, that this is another option, at-home option that you have right here. And then again, what is the difference between the hat and the in-office laser? Is one better than the other? So both of those, and it looks like we've got another one on the is it good to use both at home to assist in the treatment, or is that not needed? So that's the beautiful thing about coming in and getting a consultation, because it depends on the severity of your loss, of what protocol that you're going to be able to receive and what's going to be best for you. So to answer each question, is it good to use at home to help assist? The answer is yes. It's good to help assist, but what's great about this is it is once you get to a level with the more powerful in-office treatments, this is part of the tools that you are going to that you will be able to receive to be able to extend in that maintenance for years and years to come. The difference between the hat and the in-office laser is that it is really power output. So the in-office laser is FDA cleared class 2, which means that it is so powerful that it can only be used in a physician's office. A quick rule of thumb is with the energy output, is that about one 30-minute treatment of the in-office laser is the equivalent to about 12 to 15 treatments of the at-home laser. So the power differential there, and also the time savings that you get for getting the in-office treatment is very powerful. And on this slide here, you can see it is app-based. And you do get a free second user if there's anybody else in your household that wants to be able to use it. But the app-based program is great because it will help you do treatment reminders and tracking so that you can be more compliant. Another question here is, what medications are potentially included in the topical prescription? Peter, that's a great question, and there are actually quite a number of ingredients that will be used. And each of those ingredients, like Dr. Robbins said, is based upon what your body responds to best and can properly metabolize. And Dr. Robbins, I'll hand it back off to you.
Okay.
Awesome.
Next slide. And then the Neo system, it's just an overview. This is, it's actually been clinically proven to be beneficial. So it is the Neo Cleanse is a shampoo. Then there's the Neo Boost is a daily spray. You're leaving that in all day. And then the Neo Core is a 1 pill per day dietary supplement. So you can be rest assured that these items work. They're clinically proven. They did a study, average age 41 years old, 73% women, 27% men, 4 months of use. And you can see if you can see that on your screen, the things that people, 90+% of people notice decrease in fallout, less hair breakage, improvement in hair strength, improvement in the growth of hair strands, improvement in the general appearance of the hair. So that's a pretty powerful adjunct to some of the other items. And that's why I was alluding to earlier. There's lots of ways we're targeting this, that we can target this hair loss. Next slide. And then we already talked about that. This is the Neo system, 3-step hair restoration support. Next slide. And then there's a light smart cap. This is pretty cool technology. It's FDA registered for safety and efficacy for both males and females with androgenic hair loss. And it's I don't understand the science behind it, but it harnesses the power of the sun to help with hair loss. And so it converts, maybe Trace can comment on it, but it switch slides there, but it boosts. Go ahead.
Oh yeah, so this is actually really interesting technology. It actually comes from the fiber that is woven inside of the cap itself. So that fiber now, and we prove this by placing each of these under a spectrometer. This is how we got to the FDA registration. What is that fiber in the yarn that is woven through the baseball cap? It does a couple of things. Number one, you're going to be able to get UPF 50 plus protection, because sun damage is obviously, we don't want sun damage if you are it's not going to be beneficial for you and your hair loss. It's incredibly comfortable to wear with the Cool Comfort technology. You can see there these kind of active pickleball players using it right now. But what it does is it takes the natural UV wavelengths of the sun and it actually filters that down into the red light therapeutic range, the FDA therapeutic range. So, this is something that is an adjunct. I wouldn't give anybody this cap, just a baseball cap, and send them home and say, congratulations, go grow your hair. What you're seeing right now, and I know this slide's coming up here next, is that this is part of the full suite of solutions to give you the most benefits and the most ways that you can to help stop your hair loss and get your hair back.
So here's he was just commenting on the suite of the non-invasive options that we had talked about. You can see around the wheel there. They're all listed there. Next one. And these are some GetHairMD male results 6 months after treatments. Maybe Trace could tell me if there's any indication of what they did, but this is non-surgical GetHairMD, the things that we talked about. I don't know exactly what they all did, but
yeah,
you can.
And this was the protocols here were the in-office laser. We had the topical delivery device as well. And Lauren, could you go to the next slide with the female results as well? I know that women respond extremely well to this non-invasively, because, like Dr. Robbins was saying, it's typically more of a diffuse loss. A lot of times in the temporal areas, a lot of times starting in the middle of the scalp there. But since it's not such a distinct pattern as males, then the results that they're getting are amazing, because it is surrounding those areas and getting them healthier. As you can see, it doesn't matter with hair color, ethnicity. One of the questions that I get a lot is, if I color my hair or highlight my hair, is this going to negatively affect it? The answer is no. You can continue to do what you do with your hair as normal. You can still use your extensions if you have extensions. So that's also not an issue either. And I know the next slide is going to be going into the offer. So I want to answer a few of these questions here. Is it better to get started with treatment early before you're losing too much hair? Well, that is a great question. And it doesn't matter what it is in medicine, the earlier that you can catch something, then the better it's going to be. But the good thing here, and especially very unique with Coach Light and Dr. Robbins, is that they do offer that surgical component too. So really, it doesn't matter what the severity of hair loss that you have, as long as you're not completely too far gone, then you will be able to be helped at Coach Light and Dr. Robbins. There's another question: if you stop Rogaine, will your hair begin to fall out again? Well, so that's with Rogaine, and this is a good example of why it's better to do a multimodality treatment versus just a single modality, because with Rogaine, that is true. There will be a mass shedding event if you stop those prescriptions. However, with this being able to track it with the AI analysis that we saw at the beginning of this, as well as having a multiple different options at your disposal, then if you do decide to get off of these prescriptions, that can be mitigated and titrated down so that there isn't a mass shedding event. Another question is, how often is the office laser? That's a great question, Donnie. The best way to get that answer is actually to come in and get a consultation with Stacy, because she's going to be able to tell you exactly where you are in your severity of loss, and that will depend, and that is going to determine what your protocol is going to look like. So that's a great question. Do you have, and then I think the last question might be for you guys, Lauren.
Oh yeah, get me this chat up here. Can you read it, Trace?
Yes, says, do you have any before and afters of your patients you can show? And I know I've actually seen some of your before and afters with, and I think Dr. Robbins and some of the team members might have some as well, but I don't know. I don't know if they're on these slides right now.
I don't think
they're not on the slides,
yeah.
But go ahead. Yeah.
We kind of go over some of those repeat hair analysis before and afters during the consultation, show you actual patients that have done like the red light therapy and what their hair analysis looked like prior to starting treatment and after treatment.
Yes, and it's a good segue to thank you for good job, guys, everybody. We are well on track here at 12:33. So that's exciting. And wanted to share with everyone who's still on the call and appreciate you watching our program. We are doing a treatment package giveaway, and that lucky winner, I have drum roll please, randomly selected is Nora W. And you're still on the call, and I will message you in the chat here, Nora, to follow up with you on congrats on being the randomly selected as the winner.
Yahoo.
And then for all attendees, we're offering a event-only offer for attending this webinar, which is you get a complimentary consultation to come in and see what you're a best candidate for, and that hair matrix assessment. We'd like you to complete that consultation by January 31st, 2026. And then you will also be eligible for our treatment modality discounts, depending on what's best for you and what options would serve you best. And certainly doing that during a consultation, Stacy will help assist in what's going to be the best program for you. So look out for messaging from us as well regarding those promotions. And otherwise, you can book a consultation with us by visiting DSMPlasticSurgery.com and book a consultation by January 31st to be eligible for those offers. That's all I have for a pitch, guys. Do you guys have anything else, Dr. Robbins, Stacy, or Trace?
No, thanks for everybody that joined, and congratulations to, what is it, Nora?
Nora W. I won't say her last name, but I hope your ears are ringing.
I'll see you soon.
Yeah.
All right.
Take care, everybody. Thank you.
Thank
you. Thanks, guys.
Bye-bye.